This education tutorial will go over KBMA, our student nurse training. KBMA, we will start with just the facts. What is KBMA? It stands for Knowledge-Based Medication Administration. This tool allows us to safely administer patient medications. And the application does not make our medication administration faster, but it does make it safer and is a vital part of our patient safety. KBMA does not replace nursing judgment. You must still perform the 6 rights, including identifying your patient and visually verifying the medication before administering. And remember to always protect the barcode. You must scan the barcode on each medication, so make sure you do not open the package prior to scanning. We will now go over patient ID bands and barcodes. The patient ID band will have a series of 2D barcodes and linear barcodes. The linear barcodes will be used for your blood sugars. The remainder of the barcodes will be used for medication administration. We will now go over some frequently asked questions. In KBMA, you may experience some alerts or warnings. You will see these if you scan the wrong patient's armband, you scan the wrong medication. The order is for multiple tablets and you only scan one. You are to administer a partial dose of the medication dispensed. You have a high-risk medication. You scan a different medication that does not know which task to match it to. Or you scan a medication and it's not due yet, so it's the wrong time. These can be addressed within the KBMA application. KBMA will affect narcotic waste. You will need to prepare all medications at the bedside, except when you are wasting narcotics and preparing insulin. For non-tablets, you will waste before going to the patient's room. Make sure to take the medication vial into the room so you can scan the barcode. You may use a Carpujet holder to administer or waste the medication. Waste into the pharmaceutical bin, and document the waste in the Omnicell before going into the patient's room. For vials such as Ativan, you can drop into the syringe, waste in the pharmaceutical bin, and then document the waste in the Omnicell before going to the patient's room. Make sure to label the syringe according to the policy. Or, you may drop the waste amount into the syringe, waste it, and take the whole vial and syringe into the room and pull up the remaining dose. For tablets, you will need to waste the medication after you provide the medication to the patient, since you will need to scan the barcode. There are still tasks that you will use only your EMR for and not document using KBMA. And these will be listed as non-KBMA tasks. They'll be in their own section between the time-critical meds and medications. So any tasks within this section, for example, removing a patch, saline flushes, boluses, they do not need to be scanned. The EMR will now be sorted in the following order: core measure meds, time-critical meds, non-KBMA tasks, your current medications or scheduled, and any respiratory medications. Depending on the medication, you'll be scanning various barcodes. Some will be linear and others will be 2D. These will be actual medications, pharmacy labels, or pharmacy flags. Here are some examples of barcodes on the actual meds. It's important that our IV bags may not scan, so you're going to want to place it in front of an opaque surface. It should be easier to scan. Here's an example of a pharmacy label. There will be a 2D barcode on it. It's very tiny, but our scanners do pick it up pretty quickly. And here are some examples of pharmacy flags. These are the little labels you'll place on the actual medication that you draw up and take into the room. The nitro flags will be in the actual bin, and you'll place it on the medicine cup. Rule of thumb is to scan the pharmacy label with a barcode first. If the medication does not have a pharmacy label, please scan the product barcode. The equipment set up at the patient bedside. All patient rooms have their own computer wall mount with their own separate wireless barcode scanning gun. There is also a base for you to set the gun back into once you are completed with your medication administration. Here is what your KBMA screen will look like. It defaults to 2-hour time frames. You have the ability to go forward or backwards. You can adjust by hours. As you scan medications, they will populate to the top. It's set up like your EMR, and this will make more sense as we start scanning medications and administering them. A brief overview of our KBMA process. You're going to review your EMR as you currently do. You're going to gather all your medications, your supplies that you need to. Go to the patient's bedside, log into EMD, and pull up your EMR. You're going to scan your patient's wristband. After performing your 6 medication rights, scan your medications, acknowledge alerts, administer the meds, and mark as done. You're going to complete any further documentation that's necessary. A quick reminder. The vibration of the gun does not mean that you have made a match with your medication. It is important to watch the screen as you scan each barcode to verify a match has been made. Remember, all medications must be given with your nursing instructor. Unless you are in your preceptorship rotation, then the medications can be given with your RN preceptor. The first thing we're going to talk about is our match on scan. After selecting your patient, you're going to locate your work list manager or your EMR. It's going to take you to a screen that we already know. Your new icon is in your toolbar at the top of your screen on the left-hand side. I'm going to click on this. It's going to take you to this page. You're going to scan your patient's armband once you've verified your 6 medication rights. It will default to the scanned drug on the right-hand side. Once we scan our medication, it will look for that in our EMR and populate to the top of our screen. On the left-hand side, it will tell you that you've made a match, as well as on the right-hand side, it will tell you that you've made a match. You're going to choose Scan Complete. Once you get to this screen, this is like your shopping cart. You're going to verify, give your meds, mark as done, and your task forms will come up so that you can enter any further information. You may cancel an administration of a medication if your patient refuses the medication at that time. It is important to communicate to your primary RN when the med has not been given and why. If you've scanned your medication and get all the way to your medication administration screen, on the bottom right-hand side, you may choose the option to cancel admin. Click on this button, you will receive an alert that asks if you are sure you want to cancel the administration. Please click yes, and then communicate to the primary RN so she can document appropriately. Multiple scans required. For this example, we'll go ahead and use our Tylenol. So for Tylenol, the dose is 325 milligrams for each tab. So if we have an order that's for 650 milligrams, we're going to, in a sense, have 2 tabs. We're going to scan our first Tylenol, and it's going to tell us that we've made a match. However, it's also going to tell you that it's multiple scans required. You've scanned 1 of 2. At this point, you will scan the second tab. It's very important to scan each tab separately to correct any mistakes that could possibly be made or the wrong medications in the wrong bin. Match made. Choose Scan Complete. It will take you to your shopping cart page. Make sure that everything is correct. Administer your medication and choose Mark as Done. You'll be then taken to your task page. For the Tylenol, if a reason is needed, in your comment section, you could go ahead and enter the temp of the patient. Once you complete your documentation, click OK on this task form. Multiple match. For this example, when you scan a medication and you have 2 orders that are identical, one may be scheduled and one may be PRN, it's going to pick up on both, and it's going to require you to tell it which one you want. So here I've scanned my medication. It says multiple match on scan. You're going to click on the medication or the order that you want to use. On the far right hand corner, it is cut off. It says select match. It will tell you that you've made a match. Choose Scan Complete and move to your administration page. You will then choose Mark as Done and complete any necessary documentation on your task form and click OK. Dose and route verification. For this example, we'll be scanning Toradol. It comes in a 30 milligram dose, but our order is only for 15 milligrams. Also, this medication can be administered via different routes. Once I scan my Toradol, a warning will come up telling me that my dose is only 15 milligrams. Acknowledge this. I'm going to choose Close. If I choose Scan Complete, I also get another warning box that says you did not verify the route that this medication was going to be given. As I click OK, the route is in a small box to the far right, and this is saying I'm going to administer it IV, which matches my order. I'm going to confirm this. Once I confirm the route, it's going to take me to my administration page. I give my medication and choose Mark as done. Here my task form will come up, asking for my administration site, and then any further documentation that needs to occur. No match on scan. If you scan a medication and receive the no match on scan error, it is important that you stop what you're doing and reevaluate. This error code is going to prevent any medication errors, as you need to stop, evaluate that you are on the right patient with the right medication and you have the right order. You will then need to cancel the scan so that you can start over. Make sure that you are in communication with your primary RN before moving on. There are a few reasons as to why you may receive the no match on scan. One of them is that it is the wrong time frame for this medication that is due. Remember, KBMA only picks up a 2-hour time frame, or it is the wrong medication for this patient. Either way, you need to stop what you're doing and reevaluate the patient and the medication. Product not found. You may receive this alert when you scan a medication and it has not been entered into our pharmacy database. Most importantly, do not call the pharmacy. We will go through the no scan process in a moment. If you scan your patient's armband and then scan a medication, you receive the alert, product not found, you'll use the no scan process. Insulin administration and sliding scale. It is important to remember that you need to scan each different type of insulin for administration. So once you've gone through the necessary steps of scanning your patient's armband and you have the blood sugar that you've obtained, you're going to walk through the steps of scanning the appropriate medication. Once you scan the insulin, if there is a sliding scale, it will populate to the right-hand side and you need to choose appropriately by just selecting. Because this administration is red, it's asking you for an override reason as to why it was late. This is purely example, but if it were late, you can go ahead and document appropriately whether the prior dose was held or you were waiting for their food or whatnot. You'll acknowledge that. The second one is a order dose warning, simply because insulin tends to be a multi-dose vial. So it wants to make sure that you're double checking you're not giving the full vial of units. You will see you have a mandatory field, which is an asterisk. So please put in the dose that you're going to give your patient. There is a decimal point, so make sure that you click as far to the right as possible. Once you enter that amount, you can go ahead and click elsewhere and the decimal will be removed so that you can verify the amount. Choose Scan Complete. You'll be taken to your task form. Once you choose the match, mark as done. On your task form, you have a series of mandatory fields. Blood sugar is not mandatory, but please enter that. You're going to put your dose amount, your administration site, and then most importantly, your co-signature. Here you will need to choose Other as an option and search for your primary RN. They will fill the co-signature area. Once you click OK, you will choose them. It will pull that nurse in, but in the comments section, you must enter your instructor's name. This will allow us to uphold the policy and still be able to document accordingly. Once you've entered all the information correctly, you will click OK, and this will complete your documentation. Not a valid scan code. For this example, this simply means that you've scanned the wrong patient or the wrong barcode. If you've pulled up your patient in EMD and you've accidentally clicked on the wrong patient and you scan their barcode, you're going to get this error code. This can also occur if you scan your linear barcode that we use for blood sugars.
Bad idea.
The last example is scanning multiple medications. For this scenario, this would be your typical workflow. You're going to gather all your medications and tools necessary for your medication administration, take it to the bedside, and scan your patient. You're then going to continue to scan each medication that you're going to administer. And it's going to pull to the top of your KBMA screen. And you'll notice that as you scan them, it will tell you if you have a match on the left and pull them all the way to the top. At this point, if you get no match on scan, product not found, you will get this during this scanning process. Once you've scanned all your medications, you're going to choose Scan Complete. It's going to take you to your administration page. You're going to give your medications. Click Mark as Done, and you will complete documentation on each medication in the task form. Necessary documentation will include mandatory fields with a red icon, which will be your IV sites, and co-signers. You will also include documentation pertinent to the medication you're providing, such as a blood sugar or other comments such as a temperature or any other type of vital signs. It will be important to edit documentation in EMR, not KBMA, when you are documenting the stop times of IV piggybacks or IV bags. You will start by right-clicking on the desired time you wish to edit. To document the completion of the administration of an IV piggyback or a continuous fluid, you must edit the previously documented task form. You will right-click, choose the option of Edit, choose Document Form, and you'll be taken back to the task description box. On the right-hand side, there is an IV stop time and IV stop date. This is necessary to fill out once an IV bag is completed or an IV piggyback is completed, but it is specific to the unit in which you work. You will notice now that there is a check mark with a little memo pad and your initials are still there.